And the numbers are in, and COVID cases and hospitalizations are spiking across New York State. According to the latest numbers from August 2nd, cases were up 55% and hospitalizations climbed 22% compared to the week before. So what's to blame for the rise in these cases?
That's right. Everybody seems to have a theory, from a new variant, summer travel, even people packing theaters from Barbenheimer.
Sharon Crowley has been looking into all these different angles and joins us live from the newsroom. Hey, Sharon.
Yeah, that's right, Natasha and Steve. The pandemic may be officially over, but COVID-19 is not taking the summer off. New York State health officials seeing an increase in the number of infections and a new, more contagious variant. This is especially important, of course, for those in high-risk groups. It might be time to again take precautions to protect your health.
She may not want to hear it, but federal and state health officials say COVID-19 is making a comeback.
My concern is, me personally, I want to try and avoid getting it multiple times because I'm very concerned about the long-term, impact.
The New York State Department of Health is reporting an increase in COVID-19 hospital admissions, although numbers are still low compared to the height of the pandemic.
Having to put the mask on and be a little bit more responsible and mindful.
Public health officials blame the spike on an increase in travel, as well as a massive heat wave in recent weeks that's driven many of us indoors.
I think we should be vigilant but not panic.
Dr. Danielle Ompad is an epidemiologist and associate professor at NYU's School of Global Public Health.
For right now, I would suggest that people just kind of pay attention, keep their eye on things. If you are at high risk for complications from COVID because you have some pre-existing conditions, you have long COVID, then you might want to consider wearing a mask in crowds.
The CDC reports a new, more contagious variant called EG5 is responsible for the majority of the recent COVID infections in the U.S.
And that one appears to be more infectious, meaning people are more likely to get it, but not more virulent, meaning it doesn't make you sicker.
Her advice for the vulnerable: wear a mask when in a crowded indoor space. Everyone else, she says, can just get up to date on vaccinations and boosters, or, of course, test if you feel sick. Advice that's simple enough, even if at this point many New Yorkers have COVID fatigue.
Well, the New York State Health Commissioner reminding New Yorkers that COVID is, of course, treatable, and if you feel sick, to call your doctors. 3 years into this, guys, there are medications to keep people from becoming really sick and having to be admitted to the hospital. Natasha and Steve?
Yeah, indeed. All right. Thanks, Sharon.